right, let's talk about one of the biggest headaches in healthcare operations, outpatient scheduling. Now, on the surface, it seems simple enough, right? But as anyone in a clinic knows, it's often a huge source of frustration, not just for your staff, but for your patients too. Seriously, just take a second and think about that. If I had to guess, for a lot of you, the answer comes right back to scheduling. It's basically the front door to patient care. And when that door gets jammed, well, the whole operation just slows to a crawl. And this is exactly why it's such a challenge. Your staff is constantly juggling multiple different systems. The EHR, maybe a web portal, calendars, all at once. And that, of course, leads to delays and really costly data entry errors. Patients get frustrated, and when things get busy, the strain on your team is just enormous. It's this manual maze that's just begging for a better way. So what is that better way? Well, the answer is an automation, specifically a technology called robotic process automation, or RPA for short. You can think of it as the ultimate digital assistant for your scheduling team. The concept here is actually surprisingly simple. RPA uses these software bots, we're not talking physical robots, to perfectly mimic the exact clicks and keystrokes a person would make on their computer. These bots navigate the same systems, they enter the same data, but they do it at a superhuman speed and with near-perfect accuracy. It's like taking your best, most efficient clerk and just completely supercharging them. Okay, so that's the what. But how does this digital assistant actually get to work? Let's look at how a platform like ZAPTEST actually does it. It breaks the whole thing down into a really simple 3-step process. First, the software literally just watches and records what your staff is already doing on their screen. That's the capture step. Second, it takes those recordings and it turns them into a smart, reusable workflow. And finally, the ZoeBot takes that blueprint and just executes the entire scheduling task automatically across all of your different platforms. So it learns from you and then it does the work for you. Simple as that. Now, understanding the process is one thing, but seeing the transformation it creates, that's where this gets really, really exciting. And this slide just lays it out perfectly, doesn't it? On the left, you've got the old way. It's fragmented, it's slow, it's full of chances for human error. But on the right, with ZAPTEST, it becomes one seamless automated workflow. Data gets handled automatically, errors virtually disappear, and patient confirmation emails, they can be sent out instantly. Let's actually put a number on that old process. On average, it takes a clerk about 10 minutes to process one single appointment. 10 minutes. Now, just think for a second about how that time adds up over a day, a week, a month. Now, with automation, that same exact process takes less than 1 minute. I mean, that's not a small improvement. That is a fundamental shift in efficiency. We're talking about a time reduction of over 90%. It's a total game changer. And a time saving that huge creates this incredible ripple effect. This is where it really matters. See, near-error-free scheduling isn't just about efficiency. It's a patient safety issue. It means you can handle way more patients without burning out your staff, which directly helps your bottom line. But maybe most importantly, you free up your skilled team from doing robotic data entry so they can focus on what they do best, handling complex cases and giving a real human touch to patients who need it most. So when you boil it all down, it's about two things, really. You're creating a vastly more efficient operation on the inside, which, in turn, delivers a smoother, faster, and much more reliable experience for your patient on the outside. There's a line from the source material that just hits the nail on the head. It says, you're not just patching a broken process, you are replacing it entirely with a scalable, intelligent automation layer. And that is a truly foundational change. So, if you take away just one thing, let it be this. This kind of technology isn't just about making things faster. It's about directly improving the patient experience through speed and accuracy, while at the same time reducing your operational costs and improving your bottom line. And that leaves us with one final big question to think about. If a process as complex and as vital as scheduling can be perfected like this, what other bottlenecks in your clinic are just waiting for their own automation revolution?